Hello there, this is Miriam from Pain Outside the Box, and today I'm going to introduce you to a very effective tool in order to help you deal with pain when it comes up and in order to help decrease the pain response. Now, to give you a little bit of background about this exercise, you have to know that all pain and all sensations in the body that are felt in the body are processed by the brain. So whether it's an acute sensation like an injury or whether it's chronic pain that's being generated through a mind-body process, it's still the brain that filters the sensation of pain. Without the brain, we wouldn't be able to feel anything, even if we burnt ourselves to death, right? So on that premise, this exercise will be effective both if you suffer from mind-body pain, from stress-induced pain, as well as if you have doubts as to whether your pain is totally mind-body related or whether there's also still some sort of damage that's contributing to it. For the purposes of this video, this doesn't really matter, because what I'm going to teach you should help you deal with any kind of pain, should help reduce the pain a little bit anyway. So, making that assumption, we could start with the exercise. So basically, I'd just like you to find a really comfortable position, make sure that you have a quiet moment. If you don't at the moment, maybe you can watch this video later when you have 10 minutes for yourself. And we can start by taking a few deep breaths just to calm down the nervous system. Okay, so just breathe in deeply, but not too deeply that you force yourself or make yourself uncomfortable. And as you release, just feel your body get a little bit more relaxed. So a few more breaths, breathing in and breathing out. Just preparing yourself for the exercise. You can also remind yourself that at the moment you're in a safe place. You've got a roof over your head, maybe you're comfortable on your bed, even if though you might not be completely comfortable because of the pain, you're still in a safe place. So breathe out, you can pretend you're releasing some of your worries, some of those ongoing thoughts and rumination. We can leave those for later. So this is the time for you to spend with yourself and with your pain. Alright, and now I'd like you to check in with your body and find a place, an area, where you either feel pain or an uncomfortable sensation. So typically if you have chronic pain in a particular area, choose that part of the body, and I'd like you now to observe it. I'd actually like you now to invite it in, because you want to know more about it, you want to be with it. So instead of trying to push it away or to ignore it like you usually do, you actually want to get super curious about it. You want to allow the sensations, the discomfort, the pain in, and you want to really examine how these feel to you. So just take a few minutes to properly examine these sensations. Notice any changes taking place, whether the pain moves, whether there's any tingling, any burning, any tightness. Pretend that you really, really need to get to know more about this sensation. So it's not about pushing it away, it's about actually wanting more of it, just for now. So stay with it. If you find it particularly challenging, pretend that you are actually breathing into this area. So you're breathing in from the pores of your skin in this area, and as you're breathing out, everything is relaxing a little bit. So you can visualize some sort of release happening as you're breathing out from this area. It's okay if the sensation gets a bit more intense in the beginning. That's because you're putting all your attention on it. But the idea is to put your attention on it so you can get a little bit more familiar. If you're feeling overwhelmed with the sensation, I'd like you to tune into the feelings that you're feeling related to this overwhelm or to the anxiety. So typically when we fear something or when we're anxious about something, we feel sensations in our chests, in our belly maybe, in our throat. We might be feeling this constricting sensation. So if that gets overwhelming, I'd like you to let go of the pain area and focus on this area now. So for those of you who are just experiencing pain or discomfort, you can keep your attention focused on this pain or discomfort. But for those of you who are noticing negative emotions, who are feeling these negative emotions in the body, I want you now to divert your attention to these emotions now, wherever they're felt in your body. So typically, as I said, in the chest, throat area. And I want you to breathe into this area now, pretending again that you're breathing in through the pores of your skin in this area, and you're breathing out through the same area and releasing, but also getting a little bit curious as to what you're feeling. Can you notice how intense the fear is? Can you notice that kind of anxiety? Perhaps it's actually worse than the pain itself. Allow it in for a few minutes. Remember, you're safe. Allow yourself to taste these unpleasant feelings, because once you do, it will feel so much better than when you're trying to bury them, when you're trying not to feel them. And if it feels overwhelming, keep breathing. Perhaps also noticing the sound of your breath. If you're feeling bold, keep inviting the sensations in. Challenge yourself, see how much you can actually take in. Challenge them to get stronger if you're feeling courageous, okay? If you're feeling overwhelmed, just keep your attention on the breath and how the air is going in through your skin in this area and out. So you're just getting more and more familiar with the sensations, with the pain, also with the sensations related to your emotions. If you feel any strong emotions, so stay with them for another minute. You can choose to stay either with the pain, with the sensations, the physical sensations, or else with the emotions, which are still causing physical sensations, right? I'd just like you to take off your attention from these areas. You're kind of zooming out now, and you're placing all your attention on the body as a whole. If you're unable to feel the body as a whole, you can draw your attention to a part of the body that you're totally okay with, that you're totally neutral about, that doesn't cause any strong emotions, doesn't cause any fears or trouble. And just focus on this area now. So all the other sensations that you interpreted as unpleasant, all the pain is now in the background. Now you're focusing on your whole body, maybe on the surface of the skin, or on an area of the body that you feel neutral about, like, I don't know, maybe your ears, maybe your fingers. If there's any sensations, any unpleasantness remaining, remind yourself that that's okay. Be more okay. The purpose of this exercise is to notice these sensations. It's not to make them go away, not right away. Okay, and when you're done, maybe you can shake a little bit. Maybe one final deep breath. Maybe you can set an intention for today, or decide what you're going to look forward to today. Maybe your dinner, what you're having for dinner, maybe your daily walk, anything that you can look forward to. Maybe your bedtime reading, if it's close to bedtime. Maybe the next day if you're going to sleep. Alright, so for those of you who are wondering what the purpose of this exercise was, and who are saying things like, oh, usually Miriam tells us not to put our attention on our symptoms because we will get hypervigilant and we shouldn't focus on our symptoms. So yeah, the purpose of this exercise is to get you to focus on your symptoms, on your sensations, for a short time and deliberately. So instead of ending up going about your day, checking in with your symptoms, wondering how it is, wondering whether it's getting better or worse, you're actually choosing a time of day when to sit with your symptoms and when to practice getting more familiar with them and more okay with them. Because in order to diffuse pain, especially TMS, mind body pain, you first have to feel less bothered by it, more okay and more neutral towards it. Then and only then will the pain subside. So for some of you, you might have experienced some relief already because you are okay sitting with your pain and you realize that after all, it's just a present moment sensation and you can actually take it. Even if you notice it, you can actually stay with it. Others might have felt a little bit overwhelmed, but I encourage you not to give up, okay? If you feel overwhelmed during the exercise, also notice the overwhelmment where you can feel it in the body, the anxiety, okay? And focus on those feelings first. It can be difficult, it can feel overwhelming, but there's a point at which the sensations stop getting intense. It's like, you know, running against a tornado, but realizing that it can just like pass right over you eventually. So take some practice, but yeah, the purpose is to get your brain to process these sensations, including the pain, okay, as less dangerous, less threatening than you usually process them. Because usually we react to pain with a certain reactiveness, you know, with certain fear, frustration, helplessness. But if you do this exercise regularly, you're going to train yourself not to be so reactive at the pain, but to just be curious and just be okay with it as a present moment sensation. so I encourage you to practice and post any comments or contact me if you have any difficulties, okay, or any issues with the exercise. And that's all for today, really. Have a nice day. Bye-bye.